So a warm welcome to our online audience today. We're so excited to have so many of you from all over the world. So make sure to introduce yourselves and where you're from in the chats. My name's Isabel and I'm calling remotely from Melbourne, Australia today. I'm a current medical student and also the Vice President External of the Australian Medical Students Association. And I've had the pleasure of working with the... Ooh. I think we've got Penyas cutting through. I've had the pleasure of working with the ICGRx team recently, so it's really exciting to see so many medical students here today as well. Today, our panel will be discussing student responses to the pandemic, so make sure to submit your questions to our speakers via the platform or via our social media. So to begin, I'll let our guests introduce themselves, where they're from, and explain a bit about their role in the pandemic response. So Maria, do you want to begin?
Sure, yeah. So I'm Maria. I'm a fourth year medical student in Scotland at Dundee University. And I, since the pandemic started, have taken up a role as a mental health support worker.
Fantastic, thank you. And what about you, Tom?
So I'm Tom. I'm doing an integrated master's in critical care this year after third year of medicine at Barts in London. And I've mostly been working in an ICU since April as a healthcare assistant.
Fantastic. And Daniel?
Hi everyone, I'm Daniel and I'm from Australia, Melbourne. Currently, I'm in between my second and third year of medical school and taking the year off to do some student advocacy for the Australian Medical Students Association as the president. In terms of other involvement, I've been part of the National COVID-19 Health and Research Advisory Committee for the government, which has been involved in providing some advice as well too, for how to navigate this pandemic.
Great. And lastly, let's see if we can get Penyas. There might be a slight delay.
Himself, he's not said.
Any luck there?
Okay, if you unmute your mic, Penyas. Great.
Hi. Hi, so I'm Penyas. I'm a fine medical student from the University of Zalo with a young emerging. So during the pandemic, I've been focusing on advocacy work, community sensitization.
Penyas, you might need to unmute yourself again.
That's fine. Penyas has been a core member of the ICGRx team, and you know, having these perspectives from across the world, I think will be very useful for all of us during this session. So, Isabel, if you want to go ahead with some of the questions that you had in mind, and then we can carry on till 12:20. Thank you.
Absolutely. So firstly, I wanted to ask our panel today, what has the role of medical students been these past few months where you're from? So Daniel, did you want to start with what the role of medical students has been in Australia?
Yeah, to be fair, I think Australia's been quite fortunate to have a relatively lower caseload than our compatriots in the UK or Scotland or other places overseas. So medical students have been on the sideline ready to jump on board. Some students have been able to get involved, being in the position of a very junior medical officer, working on discharge summaries, calling GPs and other specialties and doing a lot of the operational things at a low level. Medical students have also been involved in contact tracing, sometimes helping GP clinics, and also calling patients very early on in the pandemic to really talk to them. And apart from that, medical students also have been involved in helping doctors through childcare and looking after their children during this time as well too. And that's really been the main gist of the student involvement. And I think thankfully that's because of COVID not being as great of a peak. Otherwise we would have probably greater involvement of our students.
Yeah, that's very insightful into the Australian situation at the moment. I don't believe we have Peñas on board, but we might get Maria to give her opinion of what the role of medical students has been where she is.
Yeah, so up in Scotland, we've maybe been a bit less affected than down in England, especially the south of England. But certainly a lot of my counterparts who were in 5th year have been graduated early and started working as what we call interim FY1 doctors. So they've basically started 4 months early in the posts, in similar posts to what they would do after graduation. So that was quite a big effort from universities nationally throughout the UK to graduate their students early. And then in terms of lower years or preclinical years as well, there's been quite a big push to recruit them as healthcare assistants throughout the different NHS boards in Scotland. So the same thing has happened for student nurses. And I think also, I might be wrong, but final year student nurses, a lot of them have been hired early in a nursing role too.
So that's quite a different role between countries, we can already see as well there. The situation's obviously been extremely disruptive and confronting for many people. Tom, what do you think has been the biggest concern playing on students' minds during this time?
I think it probably varies quite a bit. Obviously, as you know, as we've heard, with where students are, and kind of what students are doing, whether they're kind of at home, not being able to contribute because they're looking after family members, and so they kind of might feel a kind of obligation to do that, but then maybe some kind of guilt at being unable to help the health service, and then so I think it's kind of being able to balance caring for your family, caring for your studies, and all that stuff alongside with potentially being able to help with the kind of efforts against it. So yeah, I think it's probably very dependent on individual people.
You're totally right in that it's been so difficult for many students to manage their living situations and how they interact with their families or other aspects of their life alongside the pressures in their studies. Maria, did you find that from a mental health perspective as well, that things changed during the pandemic in terms of the mental health of medical students? And if so, how did this change?
Yeah, I think it's, I think definitely probably because it's that stress of not just the pandemic, which obviously there's so much uncertainty about, but also in terms of actually uncertainty with your degree course. So for a while as 4th years, we didn't hear much about what we were going to be doing because rightly so, the university was focused on graduating 5th years early to fill these interim posts that were made available. And then now, for example, in my university, our finals have been delayed. We're not going to have OSCEs until actually the end of 5th year. So now they're going to have to change the calculation of our EPM score, which is essentially a score out of 100 that kind of ascertains how competitive you are for your jobs coming out of medical school. So I think in any group dealing with uncertainty like that is going to have an effect. And I think a lot of the time they're just not knowing. So we're meant to go back on clinical placement in August. We could still have a second peak before then, and actually that would be delayed further. So, yeah.
Yeah, that's quite heavy for a lot of students to deal with as well, and for such a prolonged period. Daniel, does this match the case that's in Australia in terms of a mental health perspective, and also what mental health initiatives have been going on to kind of mitigate these stresses?
Yeah, there's some great comments previously, and I think that some of those experiences definitely shared within Australia. Definitely, the anxiety and mental health has been something that has definitely spiked during COVID-19, and still continues to be one of the big advocacy points, and one of the things that we really need to ensure that our students can band together and really create that peer network to support each other. The discussion in terms of the things that we've been able to hopefully be able to procure for students include mental health first aid training to kind of support and be there as a first responder for mental health crisis, as well as telehealth and mental health support for students across Australia where possible. And hopefully those will go a long way in terms of being able to provide that extra safety net for students during this time, which is so stressful. Separate to anxiety and mental health, I think in general, students share the concerns that we see that Thomas mentioned when it comes to students needing to care about their family, whether it's our international students caring about their family internationally, or even our rural students with their families who are in rural locations. Australia is definitely a very big place, and we oftentimes travel to we oftentimes move for university. And I think in general, just as the population is impacted financially, I think medical students are similarly impacted financially too, and that just creates an extra layer of stress on top for many students who are likely to be renting or likely to be sustaining off a small job, and might not be able to cobble up enough money in this time of economic unrest as well too. So definitely a lot of shared experiences amongst all of us.
Yeah, it really is a global situation. And I think the fact that there is a lot of unity in those concerns is strangely reassuring for a lot of people, despite the fact that many of those concerns remain unresolved. Penyus, are you able to hear us now? I think it might still be lagging. So we'll move on momentarily to the next question. Tom, what changes have occurred positive?
I can hear you now.
You can hear us now? Fantastic. So
I can hear you now.
Thank you. I'll get Tom's input on this first. So what changes have occurred, positive or negative, to how students are learning medicine during the pandemic?
Okay, so the majority of students have shut down from the universities, and they have played a role in trying to mitigate the challenges of COVID. We as a country in Zambia have not faced a lot of, have not experienced a lot of cases of COVID. However, the student populace have actually tried to mitigate the they had. As about cases. So what majority of them have been,
I think the line is a bit
involved again in community sensitization
delayed.
projects and follow-up in terms of management. However, students have not been part of the frontline, the patients that have actually been admitted with COVID-19. But actually, because we've not had enough PPE materials wanted to be in the COVID response as.
Thanks for those insights, Penyus. And I think just because obviously Penyus's internet connection isn't as strong, Penyus has obviously highlighted some of the issues around there that I think are global actually, regarding students' roles, but also having the appropriate PPE in place. And I know that was something that was brought up during one of the national Twitter chats we held at Becoming a Doctor, around ensuring that actually it's all well and good ensuring students can be part of the efforts to tackle COVID, but do we have the systems and support in place for them to enable them to do that? So let's, you've got 5 minutes more, Isabel, before we wrap up the session.
Yep, absolutely. So I wanted to understand from Tom how medical students and their learning has changed during the pandemic, from your perspective.
So I mean, I would say that I've got a bit of a limited perspective on that, because I think most of my learning for my master's was actually kind of completed a couple of months ago. I think, I mean, for me, kind of having firsthand kind of experience in essentially like a 200-bed COVID ICU, I think it definitely helped, because I'm doing a master's in critical care, and so it's actually been a great learning opportunity from that point of view. But I definitely do think that people who haven't been able to have kind of the hands-on experience probably do feel like they might be at some kind of disadvantage when it comes to kind of getting the most out of a bad situation.
And I guess that experience would change quite substantially depending on whether you're a preclinical or clinical student as well. So I guess another consideration would be our first year students who are entering a new environment and aren't maybe as supported as their peers because they haven't had time to build those connections yet during this time. One question I wanted to finish on for everyone was that if you could rewind time and change one aspect of the medical student experience during the pandemic, what would it be? And we might start with Neil for this.
Start with me. One thing that I would change in terms of the student experience. It's a very interesting question. I think one of the things that I would have really liked to institute at the very beginning is to ensure that there's clear communication between the medical schools, hospitals, and students. And I think that will become the crux of resolving a lot of the anxieties that would have happened at the very beginning. And obviously, with the pandemic, everything is thrown up in the air, so it's very difficult to know where the right source of information is. And we can see that issue being replicated on a state or federal level or jurisdictional level. But just within medical students and kind of, I guess, the realm of a medical student, I think that having those clear communications and knowing that this is directly for students and students having the confidence that this information is correct is vitally important for their mental health and also the anxiety levels that have been caused by COVID.
Thank you for those insights. What about you, Maria?
I'd have to probably say pretty much the same thing. I found that it felt for us, certainly students, that we got informed about a lot of decisions and there wasn't much inclusion of students in actually making those decisions. So a lot of it was kind of maybe not so beneficial for well-being and stuff like that. But obviously they have a hard job in that they essentially have to funnel a whole round of clinical students through the same placements at the same time, because we've missed 15 weeks of clinical teaching. But yeah, a lot of the times we were hearing about things when they'd already been decided and also quite late in the game. So I'd have to say communication as well.
Yeah, and that was a different way of looking at communication. So looking at more into collaboration or more representation of students in making those decisions as well. Tom, do you have any different perspective on that question, or do you feel the same?
Yeah, I think I feel the same. And I was working in the trust before all this happened and kind of during the development of everything. And I think it was very much the same kind of from the, being essentially like a secretary in the health service, kind of feeling like decisions were being made kind of, above my head, and you kind of hear about a lot of decisions change every 4 hours, and you're kind of sitting there anxiously awaiting, people leaving a meeting room to see what decisions have been made. So yeah, I think it's kind of universal. I think that kind of thing.
And I think while it's a universal issue, what's extremely powerful today is that we'll learn a lot of skills in terms of what students and health professionals alike have done to contribute to this space, and that really do have a role in tackling this pandemic, and quite an important one as well. Peneus, did you have an aspect of the medical student that you'd like to see change if you could rewind time? You're just muted there, Peneus.
Oh, okay. So mainly, I think there has been a students needed, mainly we have had a barrier between and the decision makers. So I think we needed more efficient communication, as Daniel and Tom have already alluded to. I think that would foster greater management of the students' views being heard. In this case, we had very little of students input in terms of COVID and the like. But going forward, we need greater student involvement in terms of decision making, rather than just telling students that this and this is the decision that has been made. I think we need greater involvement and greater collaborations as has
Ready, guys?
been put forward. I think that certainly has cuts across board regardless of locality.
And those are great words to finish on today. Thank you so much to everyone for your contributions. I think despite the differences and the challenges we've faced amongst medical students in our respective countries, there were some really unifying points here about what we're anxious about, our concerns moving forward. And I think we've all come to the conclusion that communication is a really critical aspect of making sure that we continue to feel well and safe and cared for in this climate.